Hi, everybody. Today we are going to be talking about pathophysiology of the integumentary system. We're going to be talking about the disorders on page 79, the ones at the bottom in that small box. And of course, we're going to be linking them to massage. Should you massage it? Should you not massage it? If you can massage it, are there special cautions? And things like that. So the first thing that we're going to talk about is acne. Now, you all know what acne is because you all went through puberty. Acne, of course, is just inflammation of the sebaceous glands that lead to little pustules or whiteheads or blackheads. Now, technically, acne is bacteria, right? Because with an inflammation and infection of the sebaceous glands, you have bacteria build up, keratinocytes and sebum and things like that. It is not contraindicated as far as massage is concerned for, a pimple or two here or there. However, if there's an entire area of the body that's covered with pimples pretty significantly, then that would be contraindicated because as you go over that, you can spread the bacteria around to other parts of the skin, and that is contraindicated. So, if somebody has pretty significant acne or the cystic kind of acne on their face, just don't massage their face. Massage their scalp, their neck, whatever. If somebody has a lot of pimples across their chest and back, that would be contraindicated as well because you don't want to spread the bacteria, like I said. So you would have to just explain to your client why you maybe can't massage those areas until, that calms down a bit. I'm sure they'll be understanding. Okay, so that's really it for acne. The next one that we have is dermatitis, and derm means skin. Itis means inflammation. So dermatitis is inflammation of the skin, and that's all that means. So dermatitis is more of a general term. And I'm going to show you a picture. Here we are, of pretty severe dermatitis. Now this is caused by poison ivy. So what you see here are blisters of inflammation on the skin. Dermatitis is usually referred to as contact dermatitis because typically it occurs when you come in contact with something that your skin does not like. So for a lot of us, poison ivy is a form of contact dermatitis because the oil that comes off of the plant stays on our skin and irritates it. Poison ivy is not contagious. You cannot give it to someone else. It does not spread on your own body the way that you think it does. The problem with poison ivy, or any kind of poison plant, is that the oil, it's called Ursh oil, gets on your skin and you probably actually touch other places before you're even aware that you had that oil on your skin. And that's why it appears to spread on your body. But again, it's not contagious. Now, having said that, are you going to massage over somebody's poison ivy? No. There is something in massage therapy called the ew factor. And simply put, what that means is if you see something on another body when you're massaging it and you go, ew, don't touch it. It's just a good rule of thumb. Stay away from it, especially if you don't know what it is, okay? Now, this is a pretty severe example of dermatitis, but there are many, many, many less severe examples. Like for example, somebody's allergic to a new shampoo that they're using or new dryer sheets that they're using, and they start to itch and their scalp gets red or their skin gets red where their clothing were or their clothing was. Some people have allergies to nickel or cheap metal that people use for earrings that can cause dermatitis around the ear. So again, dermatitis just means inflammation of the skin and can be caused by all kinds of things. Okay, Not necessarily contraindicated unless you have something like what you're looking at here, where there's a potential to disrupt the skin. You would work around something like this. That's the ooh factor that I'm talking about. Okay, so the next one on our list is eczema. Eczema is a form of dermatitis. However, trying to move around here a little bit, there we go. However, eczema is allergy driven. So let me show you what that looks like if I can here. There we are. This is eczema. Eczema is itchy. It forms in these sort of amorphous patches. So you don't have, red circles or anything like that. It's just kind of these little red splotches here and there. Again, very itchy. There are different kinds of dermatitis. Most of it looks like this. There is a form called dyshidrosis that produces little teeny blisters, and that is highly, highly itchy. People who have eczema also have allergies. And eczema is somewhat genetic because allergies can be somewhat genetic. Sometimes because this is so itchy, people scratch it open and it oozes and weeps a bit. If you are working on somebody with eczema like this, no worries, you can work right over it. The skin is not really that irritated. Working over it with massage isn't going to hurt it. But if you notice, some oozing or weeping, or if they have scratched this open and there are scabs, then you want to avoid that area. Just work around it, just don't work that part of the arm. Just start here and work your way up to the elbow or something like that. I personally have eczema, had it periodically off and on all my life. It does not affect the way that I massage. It doesn't affect receiving a massage. So most of the time eczema is not going to be contraindicated. But if a client does have eczema, you might want to inquire about what kind of allergies they have. Some people are allergic to things that are in your lotion or oil. So you want to make sure you're not using something like that on a client who already has allergies, because that would be bad. What's next? Impetigo. Okay, this is on a totally different level. Impetigo is a bacterial infection. So we're not talking about something you're allergic to, we're talking about invasion of bacteria, and this usually occurs around the nose and around the mouth, and it usually occurs in children, typically children under 5. However, if you have clients who have kids under 5, and this is a bacterial infection, so it is highly contagious. Kids typically spread it to one another like wildfire. Basically what happens in impetigo is you get these lesions that fill with fluid, and when they rupture, they form a very characteristic honey-colored crust. And I know it's difficult to see on this image, but this is like a yellowy kind of crust. It's honey-colored. It actually looks like they took honey and they slapped it on their face and let it dry there. I don't really think that you're going to see this in your practice, to be honest, because I think as an adult, one would know that their child has a bacteria infection and then they are at risk for it as well. So I just don't think that you're going to see this. But I wanted you to be aware of it, just in case you do see something like that. Again, that's still kind of an ooh factor, but this is a bacterial infection and it is highly contagious. What's next? Psoriasis. Okay. Oh, geez. Let's see if I can get this here. There's eczema, there's psoriasis. I am screen sharing, but it's hard to share. Okay, there we are. Psoriasis is not contagious. It's not an infection. It is actually an overproduction of skin cells, but not cancerous. There is a lot of cellular activity, and the cells are replicating very quickly. And what happens is, as they push up, they form a silvery or whitish scale on top of a red base. Some of you probably have seen psoriasis before. It is most commonly found on the elbows and the knees, although it can be anywhere on the body. Most of the time it's in smaller patches like this, although I have seen individuals with very large patches of psoriasis. Psoriasis is genetic, and there are different forms of psoriasis, just like there are different forms of eczema. Sometimes people with psoriasis can have something called psoriatic arthritis, which is an inflammation of the joints in response to the same type of thing that's happening on the skin, where you have that active or overactive cellular turnover. So a patch of psoriasis like this is rather small and will not be bothered whatsoever by massage. That's not the case with all patches of psoriasis. And by the way, a patch of psoriasis is called a plaque, P-L-A-Q-U-E, plaque. In some cases, psoriasis is going to look angrier. This is not the best image, but I don't want to back out of this because I don't know what's going to happen, quite frankly. So you see the white silvery scale on a red base. The base of this can be very, very red and angry looking. And if it is, you want to avoid that as a massage therapist. Just massage around that particular patch. Psoriasis kind of goes in flares and remissions. This one doesn't look too bad. This is more in a, I don't know if this is starting a flare or it's coming down from one. It's hard to tell. But flares are quite common for psoriasis. So you could have a client who has psoriasis that's really pretty under control and you can do a full body massage, no problem. And then the next time they might come in and their plaques might look red and irritated and angry, in which case you're just going to have to massage around them. So they are a local contraindication. Somebody with psoriasis is probably going to be on medicine for it, might even be on a biologic, which suppresses the immune system. So you want to make sure you know what kind of meds your psoriasis clients are on. Interestingly, vitamin D, or not, well, exposure to the sun helps patients with psoriasis. Of course, too much exposure can cause a flare and sunburn, but just the right amount of exposure can actually help relieve some of the symptoms and some of the plaques of psoriasis. So overall indicated for massage, just might be a local contraindication when it's in a flare. What else do we have? Ooh, tinea. Tinea is fungus. And here we go. Yes, hopefully you weren't eating when I brought this up. Any tinea is a fungus. So if it starts with tinea, it's a fungus. This one happens to be tinea pedis because it's on the feet. As you can see, the fungus, like any other fungus, likes warm, moist areas. And you can have tinea anywhere on your body, but it likes folds. So this is tinea pedis. If you have it anywhere on your body, like in your axillary area, it's called tinea corporis, like corpse, tinea corporis. If you have it in the groin area, it's called tinea cruris, otherwise known as jock itch, right? What else? Oh, ringworm is also fungus. Ringworm is tinea. It's tinea corporis actually, but it's called ringworm because it starts with a red round patch, and then as it heals from the inside out, just leaving a red ring, hence ringworm. Has nothing to do with worms whatsoever. It is simply a fungal infection and should be treated as such. And there are all kinds of products on the market to treat fungal infections. In fact, you may remember Tufactin, Tinactin. Yes, well, Tinactin starts with tin, which refers to tinea, and there you go. Oh, all right. It's contraindicated. It's a fungus. It's easily spread. So if you see this on a person, don't massage it. Again, you still have that you factor there. You see this and you go, ooh, don't touch it. Don't touch their feet. Just massage the legs and everything else and move on. But this is contraindicated. Any patches of fungus are contraindicated because it is spreadable on that person and it is spreadable to you. Okay, it's just a topical fungus. Yeah, so this is tinea pedis, also known as athlete's foot. I don't know if I mentioned athlete's foot, but you probably already knew that. Okay. The last one then is urticaria. And I didn't get a picture of these because I'm sure you know what they look like, but I'm just gonna type it in anyway. Urticaria. Urticaria are hives. See, hives. And if you've never seen hives before, this is what they look like. If you've never had hives, good on you. Hives are allergic reactions, but what the difference between a hive and some other kind of allergic reaction is that a hive or urticaria produces these raised, inflamed patches called wheals. Now it's W-H-E-A-L-S, wheals. And these do subside, although they are highly, highly itchy when they are active, and they are caused by a massive release of histamine in that area. So this is from some kind of allergy, something you got bit by, something that you rubbed up against. That is what causes urticaria. And if they're really big, like these over here, underneath my face here, that's called giant urticaria. Sometimes hives are idiopathic. Idiopathic means no known cause. In other words, you could just wake up with hives one day and for no apparent reason, and then they'll just go away throughout the day, okay? So that's hives. Now, I do wanna mention though, that hives are a massive release of histamine. So if you see hives beginning on your client while you are working on them, it means that they are allergic to something that you are using, and you must stop and try your best to clean the client off. I have only had this happen one time, and this was in class. There was a student, we were doing exchange, and he just happened to be allergic to something in the lotion that his classmate was using, and he started getting hives all over his body. And of course we had to stop. And that's in 20 years. So it's not likely, but I wanted to make you aware that that is a possibility. So where possible, please use products that are hypoallergenic, scent-free, things that are unlikely to irritate a client's skin. Okay, gonna stop the share right there. All right, so we've gone over all of the disorders on page 79. Hopefully you have a better understanding of some of the things that can go wrong with the skin and how to react to them as a massage therapist. And of course, if you have any questions, you may post in the discussion board. So that is it for this lecture. Have a nice day.